On the schematic drawing, the two thin, elongated pancreatic limbs are uniting at the level of the pancreatic body, seen just ventral to the main portal vein near the hilus of the liver. The left limb of the pancreas lies along the greater curvature of the stomach, while the right lobe of the pancreas lies along the descending duodenum. As the pancreas is large between the stomach, descending duodenum, and part of the colon, it is often challenging to identify the entire pancreas, especially since the left limb tends to dive dorsally towards the body. The sonographic image A corresponds to the scanning plane A, transversal to the mid-left lobe of the pancreas, that appears as a roughly triangular, finely echogenic structure lodged between the gas-filled stomach and a collapsed transverse colon in this dot. As we move to image B, corresponding to the scanning plane B, transverse to the descending duodenum and right limb of the pancreas, now we identify a layer wall of the descending duodenum with the lumen centrally located and a roughly triangular echogenic pancreas with a discrete anechoic structure representing the pancreatico-duodenal vein. You notice that the pancreatic echogenicity barely contrasts to the adjacent liver. Image C corresponds to now a sagittal view of the right lobe of the pancreas, and we see it as an elongated, uniformly echogenic structure lying superficially to part of the right kidney. During the video clip of the real-time evaluation of the pancreas, we will scan starting from the left side of the stomach at the level of the fundus body, and we'll slide the probe from left to right along the side of the left limb of the pancreas up to the place where we will identify a transverse view of the descending duodenum, and then follow the right limb in both transverse and sagittal orientation, and we'll finish the scan returning towards the left side of the pancreas. To start on, we are going to observe a transverse view of the stomach with gas in its lumen, and we'll be searching for the colon. There is a short meso between the transverse view of the stomach and the transverse colon, and within that space, that's where the pancreas is usually identified. Now we identify it as this discrete echogenic structure, slightly hypoechoic to the surrounding fat. Moving towards the left side, now the pancreas barely contrasts in echogenicity with the adjacent liver. The descending duodenum is clearly identified in cross-section with its lumen centrally located, and we see the pancreas near the cortex of the right kidney. Switching our probe 90 degrees, we are going to now see the pancreas as a more elongated structure seen here, almost isoechoic to the surrounding fat. Finishing the scan back near the stomach and the transverse colon, in between these two locations, the pancreas reappears. We can then freeze the picture, place calipers to measure the overall thickness of the pancreas, and in a normal medium-sized dog, the pancreas should be about 1 centimeter thick.